Hello friends, I am Dr. Prashant Sharma and you are watching Medicos Hub 2. In the previous video, we have discussed the mechanism of non-depolarizing block. In this video, we are going to discuss the mechanism of depolarizing block. Depolarizing block is typically done by succinylcholine-like molecules. These molecules have two important features. That is, these have two quaternary N plus atoms. Another thing is that the molecules are long, slender and flexible. Such molecules were termed as leptokurare by Bovet. Against this, non-depolarizing block was discussed and the molecules were bulky. These were termed as pachykurare by Bovet. Now, what is the mechanism? Depolarizing blockers perform two types of blocks. First one is phase 1 block and second one is known as phase 2 block. It's important to note that the typical action is phase 1 block, which may or may not be followed by phase 2 block. Now we'll compare these blocks. First is onset. Onset is rapid in phase 1 block and it is slow in phase 2 block. Features of phase 1 block is having the typical features of classical depolarizing block, while the phase 2 block represents the picture of non-depolarizing block by Depolarizing. Third, what is the main reason behind the development of these blocks? So main reason for development of phase 1 block is persistent depolarization of motor end plate, while here major reason is desensitization of receptors. Now the events. What are the various events occurring during these types of blocks? First, phase 1 block. Blockers bind to, blockers like succinylcholine, these bind to acetylcholine receptors and result in depolarization of motor end plate, but as blockers are not hydrolyzed by acetylcholine esterase, so initially fasciculations occur that are followed by flaccid paralysis. Now important thing is that this succinylcholine is hydrolyzed by another enzyme which is known as plasma cholinesterase or butyryl cholinesterase. So this enzyme acetylcholinesterase, it doesn't hydrolyze the succinylcholine. So it will remain there bound in bound condition with receptors. Now what will happen? How this will be relieved? It's important to note that how it will be relieved. That plasma cholinesterase is found in plasma, which will hydrolyze the molecules of succinylcholine in plasma, and then this succinylcholine will gradually diffuse from the neuromuscular junction into the plasma. So it will be removed gradually and the block will be relieved. So this condition is having two types of fates. Either recovery will be there, usually it recovers. But if there are two major problems like butyryl cholinesterase or plasma cholinesterase is defective, or we are giving repetitive doses of succinylcholine, then plasma concentration of succinylcholine will be on higher side, and the succinylcholine molecules that are bound to the acetylcholine receptor will not diffuse, and that will result in persistent depolarization of the membrane, and thus the block 2 or the phase 2 block supervenes. So either recovery is there or phase 2 block supervenes. It supervenes in conditions like deficiency or defective butyryl cholinesterase, or when we give repetitive doses of succinylcholine. So these are the events occurring in phase 1 block. Now phase 2 block. Mechanisms in phase 2 block are: first one, pre-junctional inhibition of receptors. Now if pre-junctional inhibition of receptors will occur, then mobilization and release of ACH is decreased. Another mechanism which is most important is desensitization of receptors. Third one is activation of sodium, potassium, ATPase pump in motor and plate. All these mechanisms will bring the membrane potential towards the resting membrane potential, that is, they will result in repolarization. So this is the phase 2 block. Now train of 4 response. Train of 4 response lacks fade, or it doesn't show fade, while here the train of 4 response show fade. And last point is that post-tetanic stimulation is absent and here it is present. So this is the mechanism of depolarizing block. In next video we'll discuss the pharmacokinetics of the neuromuscular blocking agents. Hit the like button, share and subscribe our channel to get the latest updates and notifications.